Hi, I'm Joe Mullings, and this is The Other Side. Today, joining us from California is Joe DeVivo. Joe is the CEO of InTouch Health, a digitally facing solution provider in the medtech industry. And Joe's a career rock star, as I would call him, within the medtech field. And Joe, good to have you on board today and from your home out in Cali. Where exactly in California are you?
Santa Barbara, California, just north of Los Angeles.
Got it.
And thank you for having me, Joe. Appreciate being here.
You bet. God's country out there. And you and I were chatting before we went on air, and you were out in the country a little bit, more so than the city. Is that right?
Yeah, we bought a property over the mountain in the San Ynez Valley, which is Pinot country. If you ever saw the movie Sideways, you'd be driving right past our driveway. So I'm staring at a vineyard right now if I turn the screen around, and we're in some a beautiful location here.
Fantastic. Well, good for you. And so what's it like out there? I know parts of California are really feeling that stay at home demand. And what's the status where you are right there in Santa Barbara?
You know, everyone, it seems, took this seriously right away. We've had, I think the entire town has been staying home and being pretty responsible. When you do go out and take a drive around, there's just no one out. I think in Santa Barbara County, we have 88 identified cases, most under quarantine. I think there's 5 or 6 in the ICU. So we're not certainly a hot spot, and I hope we don't become one. It's been relatively rational, and the governor kind of locked down pretty quick here, but we'll see how it goes. Yeah. It's very, very scary.
What kind of influences had on InTouch? Bring us up to speed on exactly what InTouch does, and what, as a leader of the organization, have you been running into as a lot of other medtech leaders are managing through this?
So InTouch is a telehealth company. We started off with robotics that allowed to give mobility to a physician to round through the hospital, and that morphed into critical care for telestroke and neurology. We allow a hospital to extend their specialty services to remote hospitals in its periphery. And we then have networking as a managed service provider for telehealth services. And then we have software modules, et cetera. So, a lot of telehealth that people are aware of is, a patient going to a doctor and having an immediate consult. Where InTouch started was inside the 4 walls of the hospital. So we deal with the regulatory environments, we deal with the IT infrastructure, we deal with interoperability. So it's a heavy medical grade communications infrastructure. In general, and we help health systems virtualize their care and extend their capabilities.
Do you have any of your systems and any of your platforms currently in play with what's going on with COVID right now?
Yeah, actually, where each of the hotspots in the U.S. have been existing customers have repurposed their platform for its use. One being, I usually don't like talking about customers publicly, but they've spoken about it. So Providence Healthcare is a large neurology behavioral health customer. They saw one of the first cases up in Seattle. They took one of our devices, repurposed it. CNN covered it as the robot that's being used for to help patients and to help caregivers provide care, but allowing it from a distance. And even now in New York City, we have some very large installations that are being repurposed all for intensive care. It's incredible. The use cases have everything to do with either, again, allowing a physician to remotely provide care to keep a safe distance for the unnecessary physical visits, all the way to seeing patients before they come to the hospital, keeping them at home, being able to provide virtual consultations to do an initial type of diagnosis, just to make sure that if they absolutely need a test, need to be seen, then they would come in, but to keep as many people outside the health system. So InTouch has been working very hard to be a part of every step of the continuum of care. We started off in critical care. Now we're dealing with the critical or virtual care from a a consumer to a patient or to a physician. And so our platform is being utilized absolutely every single day to be an asset for this crisis.
Yeah, and certainly we're thankful for that, especially for the frontline responders and those heroes who are dealing directly with the patients and putting themselves at risk. I'm sure they're super thankful for this. Joe, you came
Well,
from the
we also have people who are in the field who are standing up these systems, installing these systems. In one of the hotspots, they are a relatively new customer, and we had done a very rapid deployment to get them online. And the emails of gratitude for what the InTouch team has done on the ground to extend their capabilities to meet more patients just bring a tear to your eye when you hear the stress they're going through, but also the excitement they get when they can do more safely.
Joe, can you give our viewers who might not be in the know on how InTouch can remove that risk or mitigate some of the risk, yet still give a great standard of care? Can you talk us through what we might imagine in our mind's eye?
Well, so you and I right now, I'm on a laptop. We're communicating through a consumer instance that's going through the basic internet. It's pretty easy for us to get on some of those, consumer platforms and have some dialogue. But when you go into the health system has a lot of security requirements that force it to jump through a lot of hoops. People think healthcare, it's almost like the analogy, having a popsicle stick is not a tongue depressor. It's two totally different things because it's got to be sterile and smooth and not splinter, and it has to be able to maintain that sterility for a period of time. And so there's many different factors you have to consider when you're doing virtual care, especially in a health system, especially when it's critical care, and especially when that patient's life's on the line. And so that dynamic is how and where we operate. And when physicians, there are a lot of touch points between physicians and patients, and not all of them have to be physical. Like right now, you and I are communicating. There's a lot of data you and I can exchange and can assess without having to be physically co-located. But when you are co-located, you have risk of infection of this really, incredibly contagious disease and virus. So by providing distance is one thing, but also having technology that's very capable where the patient is. So if all of a sudden I took 10 steps back, you wouldn't see me very well. You certainly wouldn't hear me very well. And your capability to diagnose me would be a challenge. InTouch has specifically designed devices that can turn 270 degrees, can see 30 to 40 times of magnification. So if I'm standing 10 feet back, you can see the dilation of the pupil of my eye. If you needed to see an ultrasound or a CT, they can all be transmuted through our devices to the physician. So you have more remote power. Everything that we've tried to do is provide as much remote power to the physician to be able to make life-altering decisions. This isn't about checking your daughter's braces on FaceTime. This is about communicating, having data and data exchange to make these really crucial decisions. And that's the difference between a video conferencing platform and a telehealth platform.
Joe, you came up in the early days. You were one of the early warriors at U.S. Surgical, and I believe you with Mr. Hirsch back in those days as well. And so you've seen this progression of medtech along the way, and then you moved over to InTouch. And I remember when you moved over to InTouch, there were others in the industry scratching their heads saying, how does a guy who was a warrior with the endolapro devices possibly make that jump over, and why would he? And so clearly today, it's easy to say you were prescient in understanding this, but why has the industry not embraced this and taken this COVID situation now to move digital over that threshold? What were the resistance points to an InTouch platform or some of these other telehealth platforms, both from reimbursement as well as adoption and utilization?
It's funny. I've been an AdvaMed board member for about 13, 14 years, and I've represented Smith & Nephew and AngioDynamics and InTouch and other those three entities on the board. And now when I joined InTouch, all my colleagues at other companies are like, what's InTouch? What do you do? And I'm like, well, we do these virtual interactions. Well, why would you do that? And why? And I try to explain neurology and stroke and hub and spoke, and they just don't get it. I've been pretty blessed. As you've said, I've had the opportunity to work for Mr. Hirsch and other unbelievable people that he developed at a really exciting time to see surgical stapling and laparoscopy become just a revolution. And soon after that, I actually went into surgical robotics with the founder of surgical robotics, which is Dr. Yuan Wong, who started the first surgical robot company years before Intuitive did, and ultimately sold his business to Intuitive. And I got to see, at a front row seat at each of those industries completely inflect and understand, how when a company is so far ahead and in such a white space, what power that can be. My computer motion stock was $2, converted to $6, and Intuitive is $600 today, or actually $1,800 today, because they had a 3-for-1 split. So it's just an incredible to see that type of inflection. And after my next career change, I had the opportunity to run a multi-billion-dollar division for a really good, incredible leader that I would have loved to have worked for. But the opportunity to sit with the founder of InTouch and to understand its capabilities, he showed me his vision, and I saw it clearly. And while I went to a company that was doing, $40 million in revenue, and it was a whole different dynamic, we both saw that this is what could happen. We didn't want a crisis to occur to make everyone else build this awareness to understand. But there are some very basic fundamentals. A, there is a shortage of physicians. B, regional hospitals are under tremendous pressure to provide multi-specialty care. Patients don't want to travel for care, so they want world-class care in their local hospital, which is virtually impossible. And they want the highest quality of care. And also physicians want a better quality of life. And virtual care provides all that. When you look at any industry that has a very high percentage of its cost in labor, like the service industry or restaurant industry, they're terribly inefficient. And 60%, 55 to 60% of the cost of healthcare is labor. And so it's high labor industries are highly inefficient and have a tremendous amount of opportunity to be optimized and to be leveraged and to reduce costs through improved productivity. And telehealth all has that capability, and people see it so clearly today. Wow, we don't want patients in the waiting room because they're going to infect people. Why trouble people to come into these environments? Well, you shouldn't trouble them to come into these environments before. But now regulators see it, and it's the biggest barrier we've had, Joe, has been reimbursement. The applications that InTouch does today, prior to COVID, in stroke and intensive care, were all self-funding. We didn't have a reimbursement code that paid for it. Hospitals actually made a decision that said, I'm going to buy your application and pay for it out of my hospital costs because I believe I'm going to be able to make more money. And the truth is they did. They increased market share. They brought more patients into their catchment area, and they made more money without having a fee-for-service reimbursement. But now that's changing. We've seen the president. We've seen now Medicare patients have the opportunity to have telehealth. We're seeing existing doctors who have existing relationship with patients now being paid for a virtual consult because it's incredibly productive and it's the right thing to do in this crisis. And we, in the telehealth side, believe that as this crisis goes, and hopefully sooner rather than later, people will realize the efficiency and the utility that telehealth provided, and then make it permanently reimbursed. So this becomes a normal part of our lives. And I think, we were just talking before we started on travel and being at home, and how all of this grounding of everybody might change some behaviors permanently. And I certainly think telehealth will be one of those.
As we look at this, and certainly I'm hoping that the world, not just our government, pivots now and realizes that this won't be the first sort of world war against viral exchanges amongst a really borderless world these days. What does a telehealth COVID facility look like that maybe is built out in the middle of this country or built in out on the fringes of places like New York City that could be potential clusters? From a telehealth, imagine that with me. What does it look like, and why does it look that way?
Well, some of the most progressive CEOs, health system CEOs, who had actually envisioned, you take a Dr. Steve Klasko down over at Thomas Jefferson, for example, he foresaw what the ability of telehealth can do to his health system. He's in a very tight geographic area, has a lot of specialty concentrated, wants to have extending the influence of the health system. I think this is less going to be about certain unique telehealth centers for particular crises, and it's going to be more of a reimagining of the flow of healthcare. We can treat many more patients efficiently by putting the right patient in the right environment. You don't need to have patients come into a surgery, an area where surgery or there's interventions, when they're just coming in for a pre-op visit or a post-op visit, or they're having a basic follow-up or post-procedural follow-up. So what you're going to see is being able to leverage the existing infrastructure more productively. Having the high value, high risk patients are the only ones that go into these high cost, high value environments. And then, looking at step down locations where they have, lower acuity, but there's still a need, whether it's, imaging and radiology or some type of diagnostic where a patient has to visit. But if you imagine taking almost half of the encounters just out of the health system, being able to leave the patients in their home, being able to get much more productivity out of your physicians, I think there are analogs for this. You look at banking, for example. Many people thought 20 years ago, when banks online would start doing transactions, that it was the end of the traditional bank. What did they do? Well, they just really right-sized. I still drive down the street and there's branches of banks that we all see, but we go into those branches only when we really have more complicated or more complex transactions. And so I think what we're seeing is the ability, you see, healthcare has been this accelerating cost for decades, and now it's such a high percentage of the overall GDP. I actually firmly believe that if there are 5 solutions to that healthcare crisis, I don't know what all 5 are. I can tell you one of them is virtual care, because it meets all the criteria. It reduces the load on the health system. It utilizes infrastructure that patients own. It's a delighter to patients, and I think it's here to stay. So I think it's more about reimagining the engagements you have with your clinician. I think every clinician, whether they're a surgeon or a specialist, there's going to be certain steps in the way where it would have been face-to-face that'll just now be virtual, and that'll make healthcare much more productive.
And I also want to reimagine not just the technology that is enabling this, but also maybe the workflow. Maybe the physician doesn't have to be the person face-to-face because they're already busy. Maybe there's a new function that arrives within the healthcare continuum. Maybe natural language programming that's used everywhere else is incorporated into the healthcare continuum, so the doctor doesn't have to be head down taking notes instead of engaging with the patient. So it's just mind-bending to me.
Yeah, what's fascinating about that thought is, so right now you and I are engaging. I see you, you see me, and we have a digital barrier between us. And that digital barrier now, or a digital window, is providing a lot of data. And there is advanced machine learning and AI that can, what did I mention before? I want to empower the remote physician to have as much capability to make a diagnosis. Well, that empowerment is not only a capability, it's also an efficiency. For example, we have prototype software where, because we're going through a digital interface, I can use voice recognition to populate a note. Now, there are companies out there today who are doing voice recognition, but what's their biggest challenge? Well, I have to put glasses on a doctor so they can see the patient, so someone else can take the note, or I have to have microphones in all the patient rooms. So that's a massive challenge. But we don't need that right now as you and I are communicating, because the audio can be pulled into a processor. And then it can say, and if all of a sudden I say, you're looking a little pale, I'm going to give you, zithromycin, or I'm going to give you a Z-Pak, or I'm going to give you this prescription. Through the pulling of our audio, it all of a sudden triggers a note that says, okay, diagnosis, here's diagnosis. So I can say, I think you have this type of diagnosis and you're this, this, and this. And it populates a note. I think from a treatment standpoint, we're going to put you on this med, this med, this med. It pulls it into the note. And then by the end of the consultation, the CPT codes are identified, the diagnosis is identified, the treatment is identified, and then the doctor just reviews that note for accuracy. It doesn't have to, he or she doesn't have to stop and then repopulate and have to go through, a dictation that then has to be reviewed later. It's all automatically been dictated. So imagine that efficiency now where the doctor has that capabilities. Now, also, we have technology today that is not too far away, but I'd be able to, through the camera that's looking at your face right now, I could tell you what your blood pressure is, because the camera can actually see the pulsations of the microcapillary system in your face, and you can actually you can see as that pulsatility is determining a level of blood pressure. Or I can see blood oxygenation in your face, or I can see sentiment analysis. If you give me that scowl you're giving me right now, I'm like, oh, Joe's getting mad because I'm talking too much. Oh, he smiled. So then I'd see. And so there are actual ways that would track the motion of your face and give the physician the ability to track your sentiment. And especially, what happens in a lot of ER behavioral health visits is patients get more and more aggravated through the consultation, and you can see the blood pressure going up, you can see the sentiment. So because we have that digital interface between us, we can plug it into some really sophisticated software and some really capable computers to process it, to give, again, what are we trying to do? The remote physician as much power and efficiency. So this just doesn't, it starts with the video interface. And then, it's documentation, automation, sentiment, diagnosis. I can toggle a screen right now and I can see your if I have a thermal device with you, I can see your heat map. I can see if the left side of your face is warmer than the right side of your face. And all of these things create, massive capabilities, automations that I think are really going to change healthcare.
No, I agree. And, we had somebody, I don't know, I think you probably know Tal Wendrow, who has Vocalis, and they're using voice just as a signal to diagnose. They're actually going through a study right now for COVID. I know they've done something on congestive heart failure and some others. So you're right. And it's a very interesting perspective, Joe. It's a digital window that, if not but for. And ultimately, the docs make more money, which is good, because then they'll use it more. Because right now, they're stuck on just how many human beings can walk into their office in a day and how can they process the efficiency. So
that's right.
This is all brilliant
That's
stuff.
Exactly right.
And it's unfortunate that we had this crisis come in. But, out of these scenarios, oftentimes you have these tremendous leaps in technology that people finally go, oh, now I see, right? I didn't want to hear about it before. Yep. Now I see. So,
right.
Joe, as we close out, you're a CEO who right now is another wartime CEO. You've been through 90 and you've been through 2000, 2001, 2008 as a leader. What are you doing now, and what are you telling your team right now in 2020 on March 31st without having a horizon yet on what the outcome of this COVID crisis is?
We're very blessed to, within our business, be a part of a solution to this crisis today. And the first thing as an organization we do is we've always been very mission driven. The first thing we do is we make sure our employees are safe. So all of our employees in Belarus and in Argentina and in Georgia and in Santa Barbara and our field personnel around the world, we have given them the ability to, of course, be virtual and have the freedoms and do whatever is necessary. And if their job has been disruptive, because they can't do it virtually. We've given them something else to do. So we've taken care of our employees. We've made sure they're safe. We do have a facility in Goleta, California, where we do manufacturing, and we've been very cautious. And so we are doing, all CDC guidelines on spacing. We don't let anyone get in processes too much proximity, cleaning, PPE, everything that we could do to protect our employees. And so that really is first. But this has been really painful because our customers are hurting, our caregivers are scared, and they're desperate, and they want to move quickly. And some of our infrastructure simply, didn't contemplate this kind of volume. And so we've stopped all new feature development. We've stopped all of new R&D in general, and all of our hundreds of engineers are just focusing on scale, volume delivery, ease of use, because our whole focus has been to take the technology out of the equation so the physician and the patient can successfully interact. And it's been a challenge to deal with the volume that we've received, whether it's been physical production, whether it's been in bandwidth, or whether it's been in the sheer volume. And so, what drives our employees is the email that we received the other day I talked to you about earlier, that would really literally bring a tear to your eye as to how they appreciate us being there. And our company just is making sure that we are all hands on deck 24/7 to make sure that the health system customers are safe and meeting the needs of the patients and getting through this crisis. And really right now, if our employees are protected and we can deliver that for our customers, really nothing else matters. We can't predict how long this is going to take. We don't know the levels of complexity. We just have to stay mission driven and stay focused, protect our people, deliver for our customers. And we are fortunate to be in an industry that can help this crisis. And so many other companies in this economy are having to lay people off or dealing with real significant financial hardship. Our biggest challenge today is we can't grow fast enough. We can't deliver fast enough, and we're racing to do that for really. The frontline heroes. It sometimes it gets overstated, or it gets over communicated, but not as understood at how much they're putting their lives on the line, how scared they are, and we really need to do everything possible for them.
Agreed. And I'm glad that you're one of those leaders through InTouch that's got the opportunity to do so. They're lucky to have you behind them. Well, Joe, listen, I appreciate you joining us today from California, and always sharing with us where the future is today on telehealth and where we're going. And let's connect soon. I wish you well, your family well, and all your employees. So take care of yourself.
And thank you, Joe, for doing what you're doing and continuing a platform so we can communicate and educate each other through in these times. It's really special, and I appreciate being a part of it.
You bet. It's my honor. And this has been Joe Mullings with The Other Side.